listening to Rated RX. Your dose for the day.
Forget what you think about fish oil. That bottle in your medicine cabinet promising a healthier heart. For a lot of people, especially those taking a routine low-dose supplement, just in case, it may be doing far less than what you think. For years, fish oil was sold as a daily pillar of health protection. Millions of people take it, believing they're preventing heart attacks and strokes. But when researchers actually tested that belief in a massive randomized controlled trial, results were nearly as impressive as the marketing. Here's the shocking part. Omega-3s aren't useless. They just work in very specific situations. Today, we're breaking down the fish oil myth, what the evidence really says, and when omega-3 therapies actually matter. Hello, everybody. I am Xavier Hill. I'm here with Robbie and Sam. We're your Rated RX Pharmacist, and you're listening to the Rated RX Trending Health Questions Breakdown, where we dive into health topics that people are searching online. Rated RX is a proud affiliate of the Pharmacy Podcast Network, so be sure to like, subscribe, and follow the show wherever you're listening. This podcast is for educational purposes only. Never stop or change your medications. Just listening to us, okay? All right, let's get into it. Sam, how did fish oil become this billion-dollar heart shield?
Started with observational data. Populations that ate a lot of marine food seemed to have lower heart disease rates, and that sparked decades of interest in omega-3 fatty acids, especially those EPA and DHA.
And then the idea became simple and easy to sell. If fish was healthy, a capsule must be healthy too.
Yeah, and that's when nuance got lost. Like when researchers actually tested low-dose omega-3 supplements in large randomized controlled trials, especially ones for primary prevention, which is when you try to prevent the first heart attack or first stroke. The results were underwhelming. There was a massive Cochrane review in 2020, and they pulled over 86 trials with more than 160,000 participants, and they found little to no meaning reduction in major cardiovascular outcomes for people taking standard supplements. And that's not a small data set. So let's talk about specifics. Robbie, what did the major trials show?
All right, we'll start with the Origin trial, which gave about 12,500 high-risk patients 1 gram of omega-3 per day. Triglycerides improved slightly, but there was no reduction in major cardiovascular events.
When we had the VITAL trial, enrolled over 25,000 adults in a primary prevention setting. And same thing, 1 gram per day didn't significantly reduce those major cardiovascular events overall.
So the idea that the standard over-the-counter capsule protects everyone's heart, that's been overstated, right? Now, that does not mean that diet doesn't matter. The American Heart Association still recommends eating fatty fish twice a week, but eating fish as part of a healthy pattern is not the same as assuming that a softgel capsule will give you equal protection. Now, here's where it gets a little interesting. If broad supplementation doesn't help most people, why are doctors still prescribing omega-3s?
Because context matters, eh? Omega-3 isn't one thing. Most fish oils contain EPA, DHA, but different formulations behave differently in trials.
And the dose matters a lot.
Exactly. So let's talk about a group where omega-3s absolutely matter. And that will be in patients with severe hypertriglyceridemia, which is high cholesterol, specifically the triglycerides. So when your triglycerides are over 500 milligrams per deciliter or higher, your pancreatitis risk increases. Prescription omega-3s at 4 grams per day, much higher than the 1 gram per day that people are taking over the counter. But when they prescribe it, 4 grams a day, that can lower your triglycerides by 20 to 30% or more. That's very meaningful, especially clinically. Now, let's talk about the trial that changed everything. That will be the Reduce It trial. This enrolled over 8,000 high-risk patients who were already on statins, or another cholesterol medication if you don't know, and they also had elevated triglycerides. They were given 4 grams per day of prescription EPA only, and that resulted in a 25% relative risk reduction in major cardiovascular events. So that's not subtle. But here's the key. That was a very high dose of the EPA specifically in a specific high-risk population. So it does not mean that the 1,000 milligram capsules that you're taking from the store are the same thing. You have to take 4 of those to get to the same dose. So this is where confusion explodes. Most of the over-the-counter bottles of fish oil are 1,000 milligrams, but that's not 1,000 milligrams of EPA. And it's usually much less active omega-3 content. Compare that to 4,000 milligrams of purified prescription EPA using the Reduce It trial. That's a completely different intervention. So here's the twist. Another trial called the Strength trial used high-dose EPA plus DHA at 4 grams per day, and it was stopped early because there was no reduction in major cardiovascular outcomes. So now you have EPA only at high dose. There was some benefit, but then EPA plus DHA at high dose, there was no benefit. So now researchers are still debating why. The strongest cardiovascular outcome data comes from high dose prescription EPA in select high risk patients, not from general supplementation. And remember, prescription omega-3s are regulated as drugs. Over-the-counter supplements, which is why I'm not fond of them, are regulated differently and are not required to prove their efficacy before the marketing. So there's a big distinction between prescription medication omega-3s and then the over-the-counter omega-3s. Now, we're going to pivot away from heart disease and talk about another area where omega-3s, especially DHA, has much stronger and more consistent evidence, and that is in pregnancy.
So DHA is a major structural fatty acid in the brain and retina, and that's why it gets so much attention in fetal development.
Yeah, a major Cochrane review, including nearly 20,000 women, found omega-3 supplementation reduced preterm birth before 37 weeks by 11% and early preterm birth before 34 weeks by 42%.
Wow, those are pretty meaningful outcomes, Robbie. This isn't hype. This is one of the stronger examples of omega-3 producing real-world clinical benefit. Many experts' recommendations suggest around 200 milligrams of DHA per day during pregnancy, especially if dietary intake is low. That's targeted and that's evidence-based. One more important nuance: more is not always better. 2024 observational study from the UK Biobank data suggests regular fish oil supplements use may be associated with higher risk of atrial fibrillation and stroke in people without known cardiovascular disease. Now, this was an observational study, so it does not prove cause and effect. You have to do a randomized controlled trial for that. But it does reinforce the bigger message. Omega-3 use should be individualized and not just casual use. So let's zoom out. Fish oil is not a scam, but it's also not magic. It has evidence-based uses when it's the right patient, you get the right formulation, and you get the right dose. But if you're a generally healthy adult taking a low-dose fish oil capsule just in case for heart protection, the evidence does not strongly support that strategy. So to wrap this up, low-dose over-the-counter fish oil is not a proven universal heart shield. Prescription omega-3 therapy has a clear role. 1, in severe hypertriglyceridemia. for selected high-risk statin-treated patients with elevated triglycerides. And it has some data for pregnancy support for DHA intake. So, omega-3s aren't worthless. They're a tool. And like any other tool in medicine, they work best when used for the right job. You need the right tool for the right job, like using a hammer to drill a hole in a wall. I mean,
Just like that.
it
Just
might
like
work,
that.
but it's not the best way. But this episode helped you clarify any confusion around fish oil. Subscribe, share with somebody you care about, share with somebody that's on fish oil, and tell them to do a little bit more research and see if they're a right fit for it. Supplements are still medical decisions, so have conversations with your pharmacist about those. Use your pharmacist. We know about prescriptions and supplements, and we'll see you guys next time.
Rated RX, you do